Infection Prevention and Control, Potter Perry, Chapter 29. The incidence of patients developing infection as the direct result of contact during health care is increasing. Current trends, public awareness, and rising costs of health care have increased the importance of infection prevention and control. Nurses are essential in infection prevention and control. Patients in all healthcare settings are at risk for acquiring infections because of lower resistance to pathogens, increased exposure to pathogens, some of which may be resistant to most antibiotics, and invasive procedures. In all healthcare settings, healthcare providers, as well as patients and their families, need to recognize sources of infection and be able to apply protective measures. Patient teaching must include basic information about infection, the various modes of transmission, and the appropriate methods of prevention like hand hygiene and covering their cough. Increases in multi-drug resistant organisms, healthcare acquired infections, and concern about diseases such as hepatitis B and hepatitis C, HIV infection, and tuberculosis require a greater emphasis on infection prevention and control techniques. So the body's natural defenses includes the lymph nodes, respiratory system, the skin, your white blood cells, your spleen, and your stomach and intestines. Disease or infection results only if the pathogens multiply and alter normal tissue function. Some infectious diseases, such as your viral meningitis and pneumonia, have a low or no risk for transmission. Although these illnesses can be serious for the patient, they do not pose a risk to others, including caregivers. Hepatitis C is an example of a communicable disease that can be asymptomatic. It is most effectively transmitted through the direct passage of blood into the skin from a percutaneous exposure, even if the source patient is asymptomatic. So some words that you need to understand the definition are infection, and this is the invasion of a susceptible host by pathogens or microorganisms which results in disease. Colonization. This is the presence and growth of microorganisms within a host without tissue invasion or damage. Communicable disease. The infectious process transmitted from one person to another. Symptomatic. Clinical signs and symptoms are present. Asymptomatic. Clinical signs and symptoms are not present. So let's talk about the chain of infection, and we'll start with the infectious agent or pathogen. And remember that the presence of a pathogen does not mean that an infection will occur. Infections develop if the chain stays intact. It is very important that nurses follow infection prevention and control to break this chain of infection. So what are some of the infectious agents? Well, there are bacteria, viruses, fungi, and protozoa. So what are some things that affect their growth? Temperature is the main thing. Cold temperatures tend to prevent growth and reproduction of bacteria, and this is called bacteriostasis. And a temperature or chemical that destroys the bacteria, and that is called bactericidal. So let's talk about number 2, the reservoir, the source. And this is a place where microorganisms survive, multiply, and await transfer to a susceptible host. So what is the most common? The human being is the most common. Others include your animals, insect, and inanimate objects. To thrive, organisms need proper environment: food, oxygen, water, temperature, pH, and light. Aerobic bacteria require oxygen. Anaerobic bacteria thrive where little or no free oxygen is available. Your ideal temperature is between 68 and 109 degrees Fahrenheit. We just talked about some of the about the human body being the most common reservoir, and then we talked also about food, plants, animals, and feces are some other common reservoirs. So what can we as nurses do to keep the organisms from multiplying? The most important thing that you can do as a nurse is to wash your hands. Hand hygiene is the most important thing you can do for your patient. Also, dressing changes, disposal of fluid containers, and changing soiled linens. Those are just a few of the things that us as nurses can do to help break this chain of infection. So next, let's look at the portal of exit from reservoir or source. Blood, skin, and mucous membranes, respiratory tract, GI tract, gastrointestinal tract, and transplacental. This would be from the mother to the fetus. And so how can we prevent or break this chain of infection? Well, we can do clean dressings over your wounds, cover our mouth and nose when coughing or sneezing. When we're manipulating or suctioning a trach or endotracheal tubes, we can certainly use wear gloves and use proper technique when we're doing these procedures. And next is our mode of transmission. So we're going to talk about the direct transmission, indirect transmission, and droplet transmission. So for your direct transmission, this would be person to person, such as fecal or oral. Your physical would be touching your client's feces and then touching your inner mouth or consuming contaminated food. And one of the things that I see students do most often is when you put a Foley catheter in or you're doing any kind of dressing change, I notice that the hair will fall in their eyes and the student is pushing the hair back with their hand. And you've got on gloves protecting your hands, but without even thinking, you're pushing your hair back out of your eyes with those contaminated hands. Or touching your stethoscope or your blood pressure cuff after you're doing an invasive procedure. Your indirect transmission would be your personal contact, and this would be with your needles or sharp objects, dressings, and some of the environments. Droplet transmission, you have your airborne, and this is when the droplet transmission travels up to 3 feet, and this would include your coughing. So when your patient is coughing, it travels up to 3 feet, it would be classified as airborne. Vehicles, and that would be contaminated items, water, blood, food, things like this. And then vector would be your flies, mosquitoes, louse, flea, tick. So how can we protect or prevent this transmission? We can wear our PPE or our personal protective equipment, and we're going to try that on in skills lab and talk about the proper way to put it on and the proper way to take it off. And this includes to wear your gloves, your mask, your gowns, your goggles, your medical or surgical asepsis, your proper disposal of contaminated objects, and most importantly, hand washing. So, what is the major route of transmission for pathogens identified in the healthcare setting? What is the major route of transmission for pathogens identified in the healthcare setting? I hope you guessed it. Unwashed hands. Unwashed hands. So now let's talk about the portal of entry. And this would basically be the same as your portal of exit. And this is the pathway by which infectious agents gain access to the body. So what are some of those ways that can you think about? Needle sticks, obstruction of the urinary catheter, and the urine would back up in the urethra. One of my favorites is the tech comes in to take my patient down to x-ray, and the patient has a Foley catheter in. It's hanging like it should be on the side of the bed below the urinary tract. The patient the tech will come in and take the patient into the wheelchair and lay that Foley bag in the patient's lap. Well, when you do that, the urine backs up and goes right up into the urethra and causing contamination, and certainly can cause infection. So we want to make sure that we're in there when our patient is moved, and make sure that Foley bag is hanging on the side of the wheelchair, not lying in the lap or on the bed with the patient. So how are we going to prevent the portal of entry from causing infection? Well, using sterile technique, proper disposal of needles or sharps, and when you're doing a invasive procedure, you want to make sure that that skin is properly prepared, cleaning it. If you're going to start an IV or start a Foley catheter, you want to make sure you're cleaning that area properly. Okay, now we're talking about the susceptible host. And the susceptible host could be a person with a reduced immune response. They have an increased susceptibility. The immune response is the body's natural defense against infection. So how are we going to prevent this? Exercise, balanced nutrition, skin integrity. Those are just some of the ways that we would protect against or help that susceptible host protect against that infection. So what are some of the factors that put a patient at risk for infection? Infants has an immature defense against infection. They're born only with the antibodies provided by the mother. So those breastfed infants may have a greater immunity than the bottle-fed because they receive the mother's antibodies through the breast milk. So that's why we promote breastfeeding those infants. So age has a lot to do with the risk for infection. Also, smoking. The cilia lining the upper airway trap inhaled microbes and sweep them outward into the mucus to be expelled or swallowed. Smoking appears to paralyze these tiny little hairs, and so they are not able to function effectively. Stress. You don't know anything about that, right? You're just getting started in the nursing program. But students are under stress, or you don't eat properly, you're not getting enough sleep, so that makes your resistance low, and then you're going to be more prone to illness. So during your nursing career, you need to try to control that stress. Also, surgery puts a patient at risk for infection. They need increased protein. So if you have a patient that has had surgery, want to make sure that we're increasing their protein. Nutritional status, again, protein, carbohydrates, and fats increases the body's defense against infection and wound healing. And then chronic diseases such as leukemia, AIDS, lymphoma, and anemia. Those diseases also put that patient at risk for infection. Chronic, also because of the frequent and sometimes inappropriate use of antibiotics over the years in all settings, organisms are becoming more resistant. So we as nurses want to break that chain of infection. So let's have a little quick quiz here and see what we know. A patient is admitted to a medical unit for a home-acquired pressure ulcer. The patient has Alzheimer's disease and has been incontinent, and incontinent means they can't control urinating or peeing. So they've been incontinent of urine. The nurse inserts a Foley catheter. You will identify a link in the chain of infection as restraints, poor hygiene, Foley catheter bag, or improper positioning. The patient has Alzheimer's disease and has been incontinent of urine. The nurse inserts a Foley catheter. You will identify a link in the chain of infection as, if you guessed C, Foley catheter bag, you are correct. The Foley catheter bag could be both a portal of exit and also a portal of entry. Remember I said when the tech comes to take the patient down to X-ray, they just put that Foley bag in their lap or lay it flat on the bed, and then that urine goes back from the bag back up into the urethra and can certainly cause infection. So Foley catheter bag is the correct answer. So when the patient acquires an infection, you should observe for signs and symptoms of infection and take appropriate actions to prevent its spread. Infections follow a progressive course. So we're going to start with incubation period, and you really do need to know these 4 stages. As far as testing, you need to know these 4 stages. So we'll start with the incubation period, and this is the time interval between the entrance of the pathogen and the appearance of first symptoms. Then you have the prodromal stage, and this is the interval from the onset of non-specific signs and symptoms to more specific symptoms. Next is your illness stage, and this is the interval when the patient manifests signs and symptoms specific to the type of infection. And convalescence is the interval when acute symptoms of infection disappear. If an infection becomes localized, as in a wound infection, use standard precautions, appropriate PPE or personal protective equipment, and hygiene, hand hygiene, to block the spread of infection to other parts of the body or other patients. Supportive therapy includes providing adequate nutrition and rest to bolster the patient's defenses against the infectious process. The course of care for the patient often has additional effects on body systems affected by the infection. If any of these body defenses fail, an infection usually occurs and leads to a serious health problem. So what are some of the defenses against infection? The normal flora. Microorganisms that reside in the body. They do not usually cause disease when residing in their usual area of the body, but instead participate in maintaining health. So what are these florals located, or where are these florals located? Well, some are in the skin, saliva, oral mucosa, and intestinal walls. The use of broad-spectrum antibiotics for the treatment of infection may eliminate or change the flora or the natural flora, leading to a superinfection. The use of broad-spectrum antibiotics for the treatment of infection may eliminate or change this natural flora, leading to a superinfection. A superinfection develops when a broad-spectrum antibiotic eliminate a wide range of normal flora organisms, not just those causing the infection. When normal bacterial floras are eliminated, body defenses are reduced, which allows for defense-producing microorganisms to multiply, causing illness. A number of body organ systems have unique defenses against infection. Each organ system has defense mechanisms physiologically suited to its specific structure and function. Inflammation is a protective vascular reaction that delivers fluid, body products, and nutrients to an area of injury. The process neutralizes and eliminates pathogens or dead necrotic tissues and establishes a means of repairing body cells and tissues. Signs of localized inflammation include swelling, redness, heat, pain or tenderness, and loss of function in the affected body part. When inflammation becomes systemic, other signs and symptoms develop, including fever, increased white blood cells, malaise, anorexia, nausea, vomiting, lymph node enlargement, or organ failure. After tissues are injured, a series of well-coordinated events occur. The inflammatory response includes vascular and cellular responses, formation of inflammatory exudates, and this is fluid in cells that are discharged from cells or blood vessels, such as pus or serum, and tissue repair. Injury causes tissue damage and possibly necrosis. As a result, the body releases chemical mediators that increase the permeability of small blood vessels, and fluid, protein, and cells enter the interstitial spaces. Due to the physiological inflammatory response, the involved body part may have a temporary loss of function. The cellular response of inflammation involves white blood cells arriving at the site. White blood cells pass through the blood vessels and into the tissue. Through the process of phagocytosis, specialized white blood cells called neutrophils and monocytes ingest and destroy microorganisms or other small particles. Leukocytosis, or an increase in the number of circulating white blood cells, is a response of the body to white blood cells leaving blood vessels. Exudate may be serous, which is clear like plasma, sanguinous, and this contains red blood cells, or purulent, which contains white blood cells and bacteria. Usually, the exudate is cleared away through lymphatic drainage. Platelets and plasma proteins, such as fibrogen, form a mesh-like matrix at the site of the inflammation to prevent its spread. When there is no injury to tissue cells, healing involves the defensive, reconstructive, and maturative stages. Damaged cells are eventually replaced with healthy new cells. So let's look at a case study. Miss Eldredge is a 63-year-old woman who underwent a total hip replacement. Kathy Jackson is a nursing student caring for Miss Eldredge on her home health clinical rotation. 2 weeks after surgery, Miss Eldredge complains to Kathy that she has increased pain in her hip and low-grade fever. Kathy observes the incision and notes that it is red, swollen, and warm. So what do the fever and the warm, swollen incision likely indicate? Well, the inflammatory response has certainly been engaged, so the incision may have become infected. So is an infection at the wound site likely to be systematic or localized? Wound site infections are usually localized. Healthcare associated infections, or HAI, can occur as a result of invasive procedures, antibiotic administration, the presence of multi-resistant organisms, and breaks in infection prevention and control activities. Invasive procedures, medical therapies, long hospitalizations, and contact with healthcare personnel increase a hospitalized patient's risk for acquiring a healthcare-associated infection. Meticulous hand hygiene practices, use of chlorhexidine washes, and other advances in intensive care infection prevention help to prevent these infections. Patients at greater risk for these healthcare-associated infections are patients that have multiple illnesses, older adults, poorly nourished clients, and compromised immune systems. So what are some of the types of healthcare-associated infections? An iatrogenic infection is a type of hospital care-associated infection that results from a diagnostic or a therapeutic procedure. For example, procedures such as bronchoscopy and treatment with broad-spectrum antibiotics have been shown to increase the risk for certain infections. Healthcare-associated infections may be exogenous or endogenous. An exogenous infection comes from microorganisms found outside the individual. They do not exist as normal floras. Endogenous infections occur when part of the body's flora becomes altered with an overgrowth results. This often happens when a patient receives a broad-spectrum antibiotics that alters the normal floras. When sufficient numbers of microorganisms normally found in one body site move to another site, an endogenous infection develops. Major sites for hospital care acquired infections include surgical or traumatic wounds, urinary and respiratory tracts, and the bloodstreams. HAIs significantly increase cost of health care. Older adults have increased susceptibility to these infections because their affinity to chronic disease and the aging process itself. Extended stays in the health care institution, increased disability, increased cost of antibiotics, and prolonged recovery times add to the expenses both of the patient and the health care institution and funding bodies. Some patients with infections have a variety of problems. It is important to ask specific questions to determine the patient's and family needs related to the risk for infection or disease status. Ask the patient how the infection affects the ability to maintain relationships and perform activities of daily living. Determine whether chronic infection has drained the patient's financial resources. Encourage the patients to verbalize their expectations so you're able to establish interventions to meet the patient's priorities. Review the physical assessment findings and the patient's medical condition to determine the status of normal defense mechanisms against infection. What are the factors that influence patient susceptibility? Well, age, nutritional status, stress, and disease process are factors that influence susceptibility to infections. As your patient's medication history, assess your patient's medication history to determine whether he or she takes any medications that increase infection susceptibility. Signs and symptoms of infection may be local or systemic. Localized infections are most common in areas of skin or mucous membrane breakdowns such as surgical and traumatic wounds, pressure ulcers, oral lesions, and abscesses. Systemic infections can develop after treatments for localized infections have failed. Be alert for changes in the patient's level of activity and responsiveness. An infection does not always present with typical signs and symptoms in all patients. Atypical symptoms such as confusion, incontinence, or agitation may be the only symptoms of an infectious illness. Laboratory values such as increased white blood cells and or a positive blood culture often indicate infection. Laboratory values are not enough to detect infection. You need to assess other clinical signs as well. Let's try another quick quiz. You're caring for a patient who underwent surgery 48 hours ago. On the physical assessment, you notice that the wound looks red and swollen. The patient's white blood cells are elevated. You should A. Start antibiotics, B. Notify the provider, C. Document the findings and reassess in 2 hours, place the patient on isolation precaution. On physical assessment, you notice that the wound looks red and swollen. The patient's white blood cells are elevated. So what should you do? If you picked B, notify the provider, you are correct. When a patient shows signs of infection, the nurse should notify the provider immediately to ensure immediate treatment is given, possibly preventing a systemic infection. You cannot start an antibiotic without an order. You don't want to document the findings and reassess 2 hours. They could really be a lot sicker if you wait 2 hours. And placing the patient on isolation precautions, well, maybe they don't need to be placed on isolation precautions. We don't know what is wrong with them right now. So when we're looking at the nursing process, we're going to first get our nursing diagnoses. And so the nursing diagnoses for infection would be risk for infection, imbalanced nutrition, less than body requirements, impaired oral mucosa membrane, risk for impaired skin integrity, social isolation, impaired tissue integrity, and readiness for enhanced immunization status. Nursing diagnoses, you have a book that you were to buy this semester, and it gives you the nursing diagnoses and how to, we don't make them up. They are already established. And so when and we're going to talk a lot more about the nursing process next week. But you need to understand that each time you do an assessment on your client, you have to come up with a nursing diagnoses. So these are just a few that would fit the diagnoses for infection. So you also have to plan during the nursing process and come up with goals and outcomes. You want to develop a care plan that sets realistic outcomes so interventions are purposeful, direct, and measurable. You don't want to set a goal for a client that you know cannot reach this goal. You want to set something that's measurable and something that you agree with, your client agrees with you in doing. Patients often have multiple nursing diagnoses that are interrelated, and one diagnosis impacts on another diagnosis. So, common goals of care applicable to patients with infections often include preventing exposure to infectious organisms, controlling or reducing the extent of infection, maintaining resistance to the infection, and verbalizing understanding of the infection prevention and control techniques, such as hand hygiene. And we're going to continue with this planning by setting our priorities. The priority of administering therapies to promote wound healing, such as improved nutritional intake, overrides the goal of educating the patient to assume self-care therapies at home. When the patient's condition improves, the priorities change, and patient education becomes an essential intervention. The development of a care plan includes prevention and infection control practices from multiple disciplines. Select interventions in collaboration with the patient, the family, and healthcare providers such as your dietitian, your respiratory therapist. Know the patient's sociocultural preferences to help you in identifying the most appropriate types of interventions. Consult with an expert in infection control when planning the patient's care. Before discharge, consult with case management to complete a home assessment and identify home health needs. Okay, we'll continue with Miss Eldredge. She continues recovering at home, and when the nurse visits Miss Eldredge, Kathy teaches her about infection prevention and control. So what are some of the examples of teaching strategies that Kathy might teach Miss Eldredge? Well, she could instruct the patient about proper hand hygiene before and after wound care. Demonstrate proper hand hygiene, explaining that the patient should perform before and after all wound care and when infected body fluids are contacted. Instruct the patient about signs and symptoms of wound infection and when to notify the physician. Instruct the patient to place contaminated dressings and other disposable items containing infectious body fluids in plastic or brown paper bags. Place needles in metal containers such as soda cans or coffee cans and tape the opening shut. Some states have specific requirements for sharps disposal, so you would need to check with your local regulations before you told the patient exactly how to dispose of sharps. Instruct patient to clean noticeable soiled linen separate from other laundry, wash in warm water with detergent, and there's no special recommendations for setting dryer temperatures. So now let's talk about the implementation. Using your critical thinking skills to prevent an infection from developing or spreading, nutrition support, rest, maintenance of physiological protective mechanisms, and recommended immunizations protect patients. In healthcare settings, implement procedures to minimize the numbers and kinds of organism that could be transmitted. Be aware that various cultural and religious beliefs or practices influence patients' decisions to seek treatment for an infection or to use methods to prevent infection, including eliminating reservoirs of infection, controlling portals of exit and entry, and avoiding actions that transmit microorganisms. Having an infection prevention and control conscious helps you to apply the principles of medical and surgical asepsis. To identify the causative organism, the nurse collects specimens of body fluids such as sputum or drainage from the infected body sites for culture. Systemic infections require measures to prevent complications of fever. Localized infections often require measures to assist removal of debris to promote heating. Use medical and surgical aseptic techniques to manage wounds and ensure correct handling of all drainage or body fluids. During the course of infection, support the patient's body defense mechanisms. Asepsis is the absence of pathogenic or disease-producing microorganisms. You have two types of aseptic technique, medical and surgical asepsis. Medical asepsis, or clean technique, includes procedures for reducing the number of organisms present and preventing the transfer of organisms. After an object becomes unsterile or unclean, it is considered contaminated. In medical asepsis, an area or object is considered contaminated if it contains or is suspected of containing pathogens. Standard precautions apply to contact with body, fluid, blood, non-intact skin, and mucous membranes from all patients. A major component of patient and worker protection is hand hygiene. The purpose of hand hygiene is to remove microorganisms mechanically from the hands and rinsing with water. Hand washing does not kill microorganisms. Healthcare workers have well manicured nails and refrain from wearing artificial nails to reduce microorganism transmission. If hands are not visibly soiled, an alcohol-based rub to decontaminate the hands in the following situation: before, after, and between direct patient contact, taking a pulse, lifting a patient, before putting on sterile gloves and before inserting invasive devices such as peripheral vascular catheter, after contact with body fluids or secretions, when removing from a contaminated to a clean body site during care, after contact with surfaces or objects in the patient's room, and after removing gloves. Generally, cleaning involves use of water and mechanical action with detergents or enzymatic products. When an object comes in contact with an infectious or potential infectious material, it is contaminated. If the object is disposable, it is discarded. Reusable objects need to be cleaned thoroughly before reuse and then either disinfected or sterilized according to manufacturer recommendations. So cleaning would be the removal of all soil, use protective eyewear and gloves, and first you would rinse the contaminated area or article with cold running water to move the organic material, wash the object with soap and warm water, use a brush to remove the dirt or material in grooves or seams, rinse the object in warm water, Dry the object and prepare it for disinfection or sterilization if indicated. Clean and dry cleaning equipment. So disinfection is a process that eliminates many or all microorganisms with the exception of bacterial spores from inanimate objects. And this includes disinfection of surfaces, high-level disinfection, which is required for some items such as endoscopes. Sterilization is the complete elimination or destruction of all microorganisms, including spores. Effective prevention and control of infection require you to remain aware of the modes of transmission and ways to control them. So for patient safety, you want to have separate personal care items for your patient. In handling exudate, you want to empty your urinals, bedpans at water level, dispose of disposable soiled items in trash bags, dispose of items with large amount of blood in biohazard bags, and handle laboratory specimens as if they were infectious. To control organisms exiting via the respiratory tract, cover your mouth or nose when coughing or sneezing. Teach the patients, healthcare staff, patients' families, and visitors about respiratory hygiene or cough etiquette. Cover your nose, mouth with a tissue when you cough and promptly dispose of the contaminated tissue. Place a surgical mask on a patient if it does not compromise respiratory function or is applicable, which may not be feasible in pediatric populations. Hand hygiene after contact with contaminated respiratory secretions. To prevent transmission of microorganisms through indirect contact, you keep soiled items and equipment from touching your clothing. Use fluid-resistant linen bags or carry soiled linen with hands held out from the body. Never carry linens, whether they're soiled or clean, up next to your body, touching your uniforms. Maintaining the integrity of skin and mucous membranes reduces the chances of microorganisms reaching a host, so keep the patient's skin well lubricated by using lotion as appropriate. After elimination, instruct women to clean the rectum and perineum by wiping from the urinary meatus toward the rectum. Keep the point of connection between a catheter and drainage tube closed and intact. As long as such systems are closed, their contents are considered sterile. Perform hand hygiene and wear gloves. To prevent entry of microorganisms into the wound, always clean outward from a wound site. When applying an antiseptic or cleaning with soap and water, wipe around the wound edge first and then clean outward away from the wound. Healthcare facilities are required to have the capability of isolating patients. Isolation practices may prevent personnel and patients from acquiring infections and from transmission of microorganisms to other persons. Barrier precautions include the appropriate use of your personal protective equipment such as your gowns, gloves, masks, eyewear, and other protective devices or clothing. Contact precautions require a gown and glove. Droplet precautions require the wearing of a surgical mask within 3 feet of a patient, proper hand hygiene, and some dedicated care equipment. Airborne requires a specially equipped room with a negative airflow referred to as an airborne infectious isolation room. All healthcare personnel wear N95 respirator every time they enter the room. If you have a patient as a student nurse with an airborne precaution, you cannot take care of that patient. The N95 respirator has to be fitted per individual. So you would not be fitted with an N95 respirator until you became an RN. So if you ever had a client that had an airborne precaution such as tuberculosis, you would have to tell your instructor that you cannot take care of that client because you have never been fitted with an N95 respirator. You want to protective environment requires a specialized room with positive airflow. A patient in isolation is subject to sensory deprivation because of the restricted environment. Regardless of the type of isolation system, follow these basic principles. Use thorough hand hygiene before entering and leaving the room of a patient in isolation. Dispose of contaminated supplies and equipment in a manner that prevents spread of microorganisms to other persons as indicated by the mode of transmission of the organism. Apply knowledge of the disease process and the mode of infection transmission when using protective barriers. Protect all persons who might be exposed during transport of a patient outside the isolation room. An infection prevention and control professional, a valuable resource for assisting nurses in controlling hospital-acquired infections, monitors the incidence of infection within an institution and provides educational and consulting services. When a patient requires isolation in a private room, a sense of loneliness may develop because normal social relationships become disrupted. This situation can be psychologically harmful, especially for children. Take the opportunity to listen to a patient's concerns or interests. If you rush care or show a lack of interest in a patient's needs, he or she feels rejected and even more isolated. And infection control professional responsibilities include providing staff and patient education on infection prevention and control, developing and reviewing infection prevention and control policies and procedures, recommending appropriate isolation procedures, screening patient records for community-acquired infections that are reportable to the Public Health Department, consulting with employee health departments concerning recommendations to prevent and control the spread of infection among personnel, such as tuberculosis testing, gathering statistics regarding epidemiology of healthcare associated infections, notifying the Public Health Department of incidents of communicable diseases within the facility, consulting with all hospital departments to investigate usual events or clusters of infections, monitoring antibiotic-resistant organisms in this situation. Healthcare workers are continually at risk for exposure to infectious microorganisms. Occupational Safety and Health Administration and the CDC publish rules, regulations, and guidelines to protect employees from blood-borne pathogens in the workplace. Now let's talk about surgical asepsis. This is a sterile technique, prevents contamination of an open wound, serves to isolate the operative area from the unsterile environment, and maintains a sterile field for surgery. It includes procedures used to eliminate all microorganisms, including pathogens and spores from the area object. Situations surgical asepsis is used. Although surgical asepsis is common in the operating room, um, labor and delivery room, and major diagnostic areas, you should also use surgical aseptic techniques at the patient's bedside when inserting an IV or urinary catheters, suctioning the trach, or doing any kind of sterile dressing changes. Because surgical asepsis requires exact techniques, You need to have the patient's cooperation. Explain how you will perform a procedure and what the patient can do to avoid contaminating sterile items, including the following: avoid sudden movements of the body parts covered by sterile drapes, refrain from touching sterile supplies, drapes, or the nurse's gloves and gown, avoid coughing, sneezing, or talking over a sterile area. Certain sterile procedures last an extended time. The nurse assesses a patient's needs and anticipates factors that may disrupt a procedure. Anticipate such a problem and place a surgical mask on him or her before the procedures begin. Performing sterile aseptic procedures requires a work area in which objects can be handled with minimal risk of contamination. A sterile field provides a sterile surface for placement of sterile equipment. It is an area considered free of microorganisms and may consist of a sterile kit or tray, a work surface draped with a sterile towel or wrapper, or a table covered with a large sterile drape. Nurses never turn their back on a sterile field or a sterile tray or leave it unattended. Nurses never turn their back on a sterile field or a sterile tray or leave it unattended. Contamination can occur accidentally by a dangling piece of clothing or an unknowingly patient touching a sterile object. When beginning a surgically aseptic procedure, nurses follow certain principles to ensure maintenance of asepsis. Failure to follow these principles places patients at risk for infection. Do not talk, laugh, sneeze, or cough over a sterile field or when gathering and using sterile equipment. A sterile object becomes contaminated if gravity causes a contaminated liquid to flow over the surface of the object. To avoid contamination during a surgical hand scrub, hold your hands above your elbows. To avoid contamination during a surgical hand scrub, hold your hands above your elbows. The edges of sterile containers become exposed to air after they are open and thus are contaminated. After you remove a sterile needle from its protective cap or after you remove forceps from a container, the objects must not touch the edge of the container. You must understand these principles, so I would make sure that I reviewed these 7 principles of sterile asepsis. We will go over these steps in our skills lab, but performing a sterile procedure, you want to don and remove caps, masks, and eyewear, opening sterile packages, opening a sterile item on a flat surface, opening a sterile item while holding it, preparing a sterile field, pouring sterile solutions, surgical scrub, applying sterile gloves, and donning a sterile gown will all be covered in your lab on Tuesday. So after we've done all of this, we want to evaluate. This is part of the nursing process. The last thing you do is see through the patient's eyes. Have the patient's expectations been met? And the patient's outcome. Measure the success of the infection control techniques. Compare the patient's actual response with the expected outcomes. And if the goals are not achieved, determine what steps may be taken. We may have to start over. And then follow up with your exposure issues. What's going on with that? A lot of times exposures occur involving non-bloodborne pathogens. Airborne and droplet diseases also pose a risk to non-immune nurses. So nurses should also receive immunizations as recommended by the CDC. So let's test your knowledge here. Which statement is true about nosocomial? infections. A nosocomial infection and a healthcare hospital-acquired infection are the same thing. Nosocomial infections and healthcare associated infections are the same thing. So which statement is true about nosocomial infections? They are a minor problem, most are not preventable, most are easily treated with antibiotics, and many are becoming drug resistant. If you guessed many are becoming drug resistant, you are correct. This ends our lecture on infections prevention. We will go over many items in our lab of how to put on our PPE, your personal protective equipment, um, how to put on your sterile gloves, how to take them off, hand washing. All of this will be covered in the lab.